We're here today to announce 2 exciting changes to Arizona's Medicaid program. Changes that will positively impact children, especially those who live with developmental disabilities. Last year, the Arizona legislature passed and Governor Hobbs signed a bill to increase the income limit for KidsCare, the Children's Health Insurance Program, or CHIP, in Arizona. Now, having obtained federal approval, as of April 1st, Arizona will be able to provide health insurance to as many as 10,000 additional children in our state. By raising the upper income limit from 200% of the federal poverty level to 225%, a family of 4 earning up to $70,200 may qualify for this program, thanks to Governor Hobbs and this expansion. Secondly, we are making permanent our ability to pay parents for providing care services to their minor children with disabilities. We started this during the pandemic to ensure that children continue to receive needed services during the extreme workforce shortages, and it led to the innovative decision to find a way to make it a permanent part of the Medicaid program. Since then, Access solicited feedback from the communities, families, advocacy organizations, and our federal partners, and found a way to continue to help families who devote so much of their time to providing specialized care to their children with disabilities. You will hear from families today who were instrumental in helping make this innovative idea a permanent part of the Medicaid program and the difference it will make in their lives. We know that there's still more work to be done to address workforce shortages. Reimbursing parents as paid caregivers is a step in the right direction and the right thing to do for children who need these critical services, from those they feel the most comfortable with, their parents. Now I'd like to invite Brandi Coon from the Raising Voices Coalition and her son Tyson to say a few words.
Good morning. Tyson is going to introduce himself briefly. Tyson utilizes a AAC device or communication device to share his thoughts with us, and he prepared these thoughts for you beforehand so that they were ready to go today.
Row 1, row 2. Speak notebook. Speak set. Speak all.
Hello, good morning. My name is Tyson. I am 8 years old. This is my talker. It helps me speak. I have used an accent device since I was 3 years old.
Thank you.
Row 1, row 2,
Turn this
row
real
3.
quick. Thank you for having us here today. Tyson and our family have been navigating the world of disability and caregiving since Tyson had contracted bacterial meningitis when he was 6 months old. At that time, he received the diagnoses of cerebral palsy, epilepsy, and traumatic brain injury. Since then, we have lived and navigated services in 3 different states, and Tyson has gained cognitive and physical capabilities through the help of home and community-based services, 5 to 6 hours a week of therapy, and daily one-to-one care. I would like to take a moment to briefly explain what an average day caring for Tyson looks like. Most mornings, he wakes up full of smiles and stretches, and we get ready for school by changing his brief, his clothes, and getting him water and food. Those, and along with his medications, go into his feeding tube. I then transfer him to his wheelchair, along with his communication device, a large backpack of medical supplies, and we head to school. Tyson attends a micro school where he is integrated with typical and special ed peers. At school, he loves to do hard things with age-appropriate learning, curriculum with modifications and socially. We have managed his daily seizures throughout our everyday activities. After school, Tyson's full-time caregivers help him at home with his physical needs, attend social activities, and navigate his many therapy sessions. In the evening, we get ready for bed with a bath, additional food, medication, and Tyson gets tucked into his safe sleep bed. Tyson's favorite activity is watching Frozen and listening to the Harry Potter books on audio. As Tyson's mom, I am both his parent and his caregiver. Those roles interweave constantly. Helping him to succeed and find fulfillment in life brings me so much joy. Regarding the reason we are here today, I want to give a brief background on how parents as paid caregivers came to be and the countless advocacy hours that took place by myself and many other parents with minors with children with disabilities. In 2020, a temporary flexibility for parents with minor children with disabilities was established. This program allowed the state to pay parents of minors with disabilities for their children's authorized DDD services. This temporary program was established to allow minors with disabilities to continue to receive services in their home despite the isolation they were experiencing due to the COVID-19 pandemic. In 2021, my coalition founder, Lauren, who's also a parent of a child with disabilities, and I began our grassroots advocacy efforts. We saw many benefits to this temporary program, including housing stability, reduced abuse rates, and continuity of care. I wanted it to become a permanent option for Arizona families. Neither of us had ever advocated professionally or knew how to impact change for our state policy. We began by creating a change.org petition, which admittedly didn't get us very far. We then began meeting with experienced advocates, disability organizations, and state leaders. After hearing that a permanent program was not a feasible option many times, we persevered in growing our grassroots advocacy community of parent caregivers, gathering data, and building relationships with elected officials in order to have our voices heard. In the summer of 2023, we were ecstatic to hear that Access was proposing to create a permanent Parents as Paid Caregivers program. Our entire community was extremely excited about this. Over the next few months, we submitted hundreds of public comments where we shared with Access our personal experiences, recommendations, and feedback regarding their proposal. Once the public comment period ended and through the voices of thousands of parents, Access amended their proposal to expand the scope of this new program to include all minors with disabilities receiving DDD and long-term care through Access. As we venture into the approval of this program, I am proud to see Arizona continue to build programs that support individuals with disabilities and their caregivers. This program joins a portfolio of other programs in Arizona that strive to solve the difficulties faced by individuals with disabilities and their caregivers on the front line. I want to thank several individuals before I close my remarks. Thank you, Director Heredia, Alex Damian, and all other Access and DDD leadership for your willingness to answer my emails, take meetings with me, and hear the voices of thousands of Arizona caregivers. Thank you, Governor Hobbs, for your Family Forward initiatives, along with raising awareness regarding abuse, neglect, and exploitation of vulnerable individuals. Thank you to disability organization leaders like Michelle Thorne, Jenny Mullins, and John Layers for your support, mentorship, and guidance. Thank you to my coalition partner, Lauren, for the late nights, laughs, and tears. Thank you to my family, who have allowed me the flexibility to focus on this advocacy project for the last 3 years. And finally, thank you to the thousands of parent caregivers in Arizona who believed in our ability to create change. You have been my inspiration. I am so excited to see you work with your children and help them continue to thrive and share their voices as we have created this permanent program for Arizona families. Thank you.
privilege of serving as the CEO of Children's Action Alliance. We exist to advocate for kids and families and really want to see the courage of the parents and the tenacity of the parents for getting this change and what taxpayer money is invested in as families. We're here to talk about the advancement that's happening today. So today thanks to the budget that was passed by Governor Hobbs and the legislature last year, and today with the approval from the federal government, we've done the right thing to get kids covered with health insurance. This is a win for 10,000 kids and teens in Arizona who can now see a doctor when they have asthma, can see a nurse when they aren't feeling well, or a dentist when they have a toothache. And the truth is, it brings so much more to a child's future. It helps them do better in school, helps them thrive. We thank KidsCare and Access. These are programs that have seen the rate of those without insurance fall in Arizona from 16% to 8% because our state's leaders and our nation leaders have prioritized health insurance for kids. When we didn't, as Governor Hobbs mentioned, like when KidsCare was frozen, we saw progress stop and we reversed. So today, Arizona is moving forward. We're not moving backwards for kids and for working families. And the truth is, we still have a long way to go, because Arizona does rank 49 in children's health insurance coverage. Until now, only 2 states covered less families than we do in terms of income. All the more reason to recognize the bipartisan leadership that led to this big win for 10,000 children. A win that can be life-changing for many and life-saving for some. And here, Governor Hobbs and the legislature not only delivered a win for children, they delivered a win for working families. For moms and dads who have 2 or 3 jobs but cannot afford private health insurance. To those who fall between the cracks. This is for them, this is for their children. Children's Action Alliance is ready to help get the job done and get all children covered. Together with our partners like Arizona's community health centers, we're helping families and individuals across Arizona get assistance to know what they're eligible for and to enroll for health insurance. So if anyone needs help enrolling and access KidsCare or a private plan on the health insurance market, they can visit coveraz.org or call 1-800-377-3536. Thank you.